My name is Drew. I'm going to be your nurse today. So the doctor has put in an order for us to insert a nasogastric feeding tube. And it's just a tube that goes down your nose into your esophagus and into your stomach. And it helps with your feedings, and you're also able to get your medications through it while you're in the hospital. So can I have you identify yourself by stating your name and date of birth, please? Thanks, Mr. Smith. Do you have any allergies or have you had any nasal surgeries in the past? Okay. So now I'm just going to sit the head of the bed into the high Fowler's position. That's to prevent aspiration during the procedure. And I'm going to remove this pillow from behind you, and I'll tell you when you need to tilt your head back and all. It'll just help you tilt your head back better. I'm going to sit this drape on you, and it's going to keep your gown from getting anything on it during the procedure. And I'm also going to give you this cup of water, and I'll tell you when to sip on that. And I'm going to give you this basin in case you feel the need to vomit. Now with this procedure, if you start to feel any signs of cyanosis, difficulty breathing, difficulty speaking, coughing, or gasping for air, I want you to let me know. And we're going to stop the procedure immediately. Now I'm just going to have you breathe normally. I'm testing your nares to see which nair is best for the placement of the tube. Okay. It appears the right nostril is best for the tube placement because there's more air going through it. Now I'm just going to measure the tube from your nostril down to your earlobe and from your earlobe to your xiphoid process. I'm going to mark it with tape. That's just to tell us when to stop inserting the tube. All right. Now I'm going to coil the end of the tube. That's going to help it go in better. Now that the tube is coiled, I'm going to lubricate it 2 to 4 inches. That's going to help it slide in better. All right. Mr. Smith, can I have you tilt your head back, please? I've met resistance in the pharynx, so now I'm going to have you tilt your chin to your chest, and you're going to sip on this water. Now, in a real healthcare setting, the tube would go into the point where I marked it with a tape, but since it's a mannequin, it will not go in all the way. Now I'm just going to tape the tube to the nose. This is going to keep it from sliding out or anything. Also going to tape the excess to the gown, and that'll just give you some slack where you're able to move your head around some. Okay. Now I'm going to dispose of this pad. And I'm going to send you down to x-ray. They're going to take an x-ray of the placement of the tube and make sure that it's in your stomach. And they'll remove the wire while you're down there. And then once you get back up, we'll be able to start your feedings. Hey, Mr. Smith. My name is Drew. Today we're going to remove your nasogastric feeding tube because the doctor said that you've got caught up on your nutrients and you're ready for it to be removed. So can I have you state your name and date of birth for me, please? Okay, thank you. And this procedure is very simple. I'm just going to put this drape on you. I'm going to have you take a deep breath, and then I'm going to remove the tube. So now I'm going to untape it from your shirt, from your gown. I'm going to give you this basin in case you feel the need to vomit at any point. You can grab that, that's there for you. Now I'm just untaping it from your nose. Okay. And now I'm going to have you hold your breath. All right. dispose of that. Now I'm just going to sit your pillow back, make it a little bit more comfortable. I'm going to lower the head of the bed down for you some. Mr. Smith, it was a pleasure taking care of you, and I hope you get to feeling better soon.